Cure bone cancer alternative treatment. A center which works to save the life and limb. Fight cancer with a smile. Get strength with positive attitude. Bone cancer is the rare illness that causes in children more than the adults. What we now know is that we are all deficient in dietary glyconutrients today, thus opening us up to this disease, and others. We are thrusting aside our health, and in this way how we are paying with the entry of new diseases in our body. The human body is made of more than 200 bones. The bones support the body and protect organs such as the heart and lungs. Bones are made of cells called osteocytes, which are bound together by a calcium-like material to give the bone strength. Bones are filled with a spongy material called bone marrow. Bone marrow makes blood cells. The bones in the body serve several purposes. They support and protect internal organs, for example, the skull protects the brain and the ribs protect the lungs. Muscles pull against the bones to make the body move. Bone marrow makes and stores blood cells. Bone cancer can be a primary cancer, starts in the bone, or a secondary cancer, starts in another part of the body and spreads to the bone. Primary bone cancer, or cancer that starts in the bone, is quite rare. The cancer that begins in the bone is called primary bone cancer. It is found most often in the arms and legs, but it can occur in any bone in the body. Less than 1% of people with bone cancer have primary bone cancer. The most common type of primary bone cancer is osteosarcoma. Children and young people are more likely than adults to have bone cancer. The causes of primary bone cancer are not known, however, adults who have Paget's disease, a bone disease, may have an increased risk. Secondary bone cancer is the most common bone cancer. It is a cancer that starts somewhere else in the body and spreads metastases to the bone. The most common cancers that spread to the bone are cancers of the breast, prostate, lung, kidney and thyroid. Cancers that begin in the bone are quite rare. On the other hand, it is not unusual for cancers to spread to the bones from other parts of the body. When this happens, the disease is not called bone cancer. Each type of cancer is named for the organ or the tissue in which it begins. Cancer that spreads is the same disease and has the same name as the original cancer. Treatment for cancer that has spread to the bones depends on where the cancer started and the extent of the spread. Pain is the most common symptom of bone cancer. However, symptoms may vary depending on the location and size of the cancer. Tumors that occur in or near joints may cause swelling or tenderness in the affected area. Bone cancer can also interfere with normal movements and can weaken the bones, occasionally leading to a fracture. Other symptoms may include fatigue, fever, weight loss, and anemia. None of these symptoms is a sure sign of cancer. They may also be caused by other, less serious conditions. It is important to check with a doctor. The signs and symptoms of bone cancer include painful bones and joints increased pain at night swelling of bones and joints susceptibility to fractures unexplained weight loss unexplained tiredness. Patients may present with persistent pain, swelling, or tenderness of a bone. They may have unexplained fracture of one or more bones, sometimes without noticeable trauma. Each one of us in our day-to-day life is exposed to innumerable cancer-causing agents. It has been reputed that approximately 70 to 80% of all cancers occur as a result of the food we eat, the air we breathe and the water we drink, as well as lifestyle and environmental factors. Roughly to say 1/3 of deaths from cancer are related to dietary factors. Our bodies have natural defense mechanisms to battle these agents, but in many cases, because of neglecting proper nutrition and exercise, and abusing our bodies by loading them with even more harmful agents, then these defenses are weakened or overwhelmed, and cancer begins to gain a foothold in the body. So if we need to come out of it, then we have to take of our health, which is the basic treatment to any disease. A number of factors are considered to decide on the best treatment for bone cancer. Among these are the type, location, size, and extent of the tumor as well as the patient's age and general health. A treatment plan is tailored to fit each patient's needs. One last consideration to take note of is that any cancer is more easily defeated if caught in its early stages. Therefore, it is very important to have regular medical checkups, even if we are feeling fine. Then 2. Learn what are the telltale symptoms for the various cancers, and at the first evidence of anything suspicious, get it checked out by your doctor.